Hey out there, Toby Stark, Stark Associates Insurance Agency. It's that time. It's the beginning of November for those folks that aren't 65 yet and Medicare eligible, but between 0 and 64. If you do not have a plan through your employer, chances are that you've gone out to the marketplace to look for an individual medical plan. So it is that time. If you're in New Jersey, Get Covered 2022. It's the open enrollment period, the opportunity when you get to review the individual medical insurance plan you have, see if it still fits your needs, and then continue on starting in January 1st, 2022. So what you need to do is between November 1st and December 31st, you need to make a change if it warrants that based upon what's happened in the past. Is the deductible too high? Do you need to lower it? Do you like the doctors that you see? Are you going to switch carriers? And we've gotten some feedback early on that heading into the 2022 season, medical insurance plans have increased in cost, but that doesn't mean that you need to stay there. Although we are a limited option state, we'd be more than happy to, as an individual insurance brokerage, help you search for a plan. And I'm going to get in a little bit of detail about not only what plan you might want, but also, are you eligible financially for financial assistance? And that's a big deal, especially coming out of COVID. So I'm going to show you the New Jersey Get Covered website and a very high level overview, and reach out to us. Phone numbers up here, email us, and we'll assist you in the process. We're happy to do so. So this is the Get Covered website, and it is open enrollment. It says open enrollments here for 2022. So what I want to steer you towards is the Get Started tab. And now also, before we get fully into it, some of you out there may not be eligible for assistance because you make too much. And what we tell our clients, and for those of you that are just looking to get a plan and might be interviewing independent agents, is you might be eligible for some assistance, and it doesn't hurt to apply. So you can go through the process and we can help you to see if there's some financial assistance that offsets your premium costs from month to month. Because if there is, take advantage of it. That's why it's out there. So let's get back to it now. So this is for 2022. You're either going to be a new customer or an existing marketplace customer. If you're new, you want to click on the new customer page here, and then there's a step-by-step guide. You're going to scroll down to enter some information to get acclimated with Get Covered website. And also, as you're doing it, it's going to ask you if you would like to request local assistance. Now, this isn't like looking up a car and buying something and it's a transaction and it's done. This is a long-term decision that could really affect you and your health. And we're here to help you handhold. And there isn't any charge for our services. We get paid by the insurance carrier on the back end. So just know that we're here to help. And if you do, look us up. Here I am, Toby Stark. Here's our office address. Here's my license number as well. We're here to help you in our office. We have a team that'll be able to provide you expert help and guide you for, depending upon whatever budget, what you may be eligible for, and also plan types as well, because everybody is uniquely different in their needs. So this is the new customer page. We'll go back here. If you get started, there's an existing marketplace customer page that's a little bit different. You're going to want to go in and update your account, especially for those folks. You got to look forward to 2022 as your income changed. Remember, if you're changing your income, it's going to change your subsidy. So you always want to make sure that it's the most accurate as it could be. Now, for those of you that are interested, am I eligible or not for a subsidy? I'm going to put it in the show notes. I'm going to link it here. The Kaiser Foundation has this great health insurance marketplace calculator that's been updated for the 2022 plans. So in this case, we're going to start and say, am I eligible for a subsidy? So we're going to I'll put the zip code for Monmouth County, and you're going to enter your yearly income as $2022. Let's say I'm going to be making $75,000. Is coverage available from your or your spouse's job? We're going to say no. We'll say there's 4 people in the family. Wow, it goes up to 15. Number of adults that are enrolling in marketplace coverage, we're going to say 2. What are their ages? Don't use tobacco. Number of children enrolling that are younger, let's just say that they are 7 and 3. So this will give you an overview and you submit. Now, based upon the information you provided, your income is equal to 283% of the poverty level. Now, this is not hard and fast, but this gives you a topical level if you're eligible. Look at the estimated financial help possibly. $988 per month or $11,852 per year as premium tax credit that covers 75% of your monthly costs. And it goes into detail here on without financial help, what it would cost, $1,320. And this tool is a good quick guideline, because if you are eligible and it makes sense that you might be, then go back into the marketplace and fill out an application. Tie us to that application so we can follow it for you. And especially when you're going to be making an insurance decision, even if you get that high of a subsidy, it's important that you understand the mechanics of how your health insurance plan is going to work when you're using it, especially if a plan has higher deductibles, because you might have saved on the premiums, but you still have to understand your deductibles and out-of-pocket costs. And God forbid, if you need to use it, how are you going to review the explanation of benefits? We're here to help you to make sure you know what you're supposed to pay for the doctor and what you may not have to pay, because it can be very confusing. So this is the Get Covered Marketplace. I would advise you just really quickly to go into this and look and see if you do qualify. A lot of you do. The marketplace says 9 out of 10 individuals that go to the marketplace do qualify for some subsidized coverage. And then also, I just want to steer you to, let me go to the home page here. Some people have talked about, well, I don't make enough, so what is this New Jersey Family Care? So New Jersey Family Care is essentially Medicaid, and those are the folks that don't earn enough to even get a subsidy. And now I just want to tell you, in the marketplace, what you do is you have the availability to enter your income projected forward for 2022. But if you're eligible for New Jersey Family Care, which is a federal government and state of New Jersey partnership, what happens here is it's estimated monthly. So if any of you that are hitting this video and are interested in New Jersey Family Care, you want to communicate to them directly. And when you're on this website, you can by clicking on the New Jersey Family Care website, and it will bring you over there. You'll be redirected and you can call them. Depending upon what county you're in, you might want to call your local county phone number for civil service. There is one in every county, and they can help assist you in New Jersey Family Care, because the point is you want to get covered. You want to eliminate any opportunity of financial harm and ruin, especially if you have a small amount of dollars that you count on. You want to make sure that you're covered. For the rest of you that have an income that's above the threshold, essentially $22,000 or $23,000, then you're going to want to be looking at, let me just go back here. You're going to want to look at the Get Covered webpage here, and we can assist you through the process. Those of you that don't qualify, what we can do is we can get you an application, we can change plans for you, but this is the time that you need to review. And lastly, what is very important is, some of you have gotten insurance this year because it was a very special year. Unfortunately, we've been going through COVID, and the governor has awarded the state a waiver where if you need medical coverage and you don't have it, you can just simply get it. Well, that COVID waiver is going away at the end of 2021. And starting in 2022, if you don't have medical coverage, you need to have a qualifying event to be able to enroll in a plan. Well, what's a qualifying event? A qualifying event could be you getting married, divorced, you move to a new geographical area, you're losing employer coverage. Those are the events. So you just can't jump on a plan after the end of this open enrollment period, which, by the way, ends on January 31st of 2022. So this is the end. So it goes from November 1st to January 31st, 2022. After that, you're going to need to submit proof to be able to get medical insurance. If you can't submit proof, you're not going to be able to enroll in a plan. So this is the action time, and I wanted to keep this under 10 minutes. Hopefully this helps you. A little bit of a guide going through Get Covered New Jersey. Bottom line is you may be eligible for assistance, and we can help. Good luck out there, and we're happy to serve the community. Take care.